Okay, I think we're ready. And do we have the exact time? Yes, it's 8:04. Well, school is out and summer 2023 and the last meeting of this term are in. Good morning and welcome to the June meeting of the Board of Health. This meeting is called to order and given board members, post-meeting commitments, we will progress as efficiently as possible. I'm refraining from saying expeditiously within X, not to jinx, but to hope everybody makes their deadlines. This meeting is being streamed live on Facebook, and our thanks to Catalina and the folks at the department. Welcome to the people who have just joined. Well, we begin with new beginnings for some as we welcome Dr. Inder, I haven't had enough coffee this morning, Single, as the new interim chief medical officer for Louisville Metro's Public Health Department and partner collaborator to this board. I had a most engaging coffee with Dr. Single, one of the most enlightening and insightful ones I've had in a long time. And so welcome, Dr. Single. Your contributions will be valuable to the department. We're blessed to have you. Dr. Single is globally recognized for his tireless efforts in rendering unique, specialized optical services, many of which have been provided at no cost to the world's most vulnerable individuals. In nearly all instances, his public service has given the populations he has served more than just the gift of sight, better health and life outcomes, but also improved access to primary and specialist services, leading to transformational opportunities for better health and economic status. We'll hear very briefly from him a bit later, and then as we begin the next term of the board, you'll hear more. Before our perspective session, we need to dispose of some governance items, including the approval of the May meeting minutes, which were distributed for your review. This time, please check the list of attendees to ensure that we have those who were present. And if you were not, please let Arlena or me know. The folks came on the screen at a lot of different times, and we want to make sure we've accurately recorded the attendance. So with that said, let's hang on just one second. Just one second. Anyway, okay, it's hard when you're pinged at the same time, and it taught me a lesson not to ping people. But thank you for the person who just sent me something. So let's dispose of those minutes. Are there comments to those minutes? Okay. Then may I have a motion to approve the May minutes as distributed?
So moved.
Is there a second?
Second.
Thank you. All those in favor of approval? Aye.
Aye.
Opposed? Abstentions? Motion carries and the minutes are approved. So now let's move to our perspective session. We've discussed many times that the current and future opportunities for positive public health system change leading to better health outcomes and status for the underserved and under-resourced is to prioritize and only render as a department those services that go unmet by any other sector. We should be serving as a convener, collaborator, and advocate for that work. As you know, to date, Louisville has provided an open door to the immigrant and refugee populations fleeing turmoil in their troubled countries. Local organizations, some of whom are represented today, provide a plethora of critical, life-sustaining basic services. including serving as culturally competent navigators for these individuals and their families as they begin to rebuild their lives. In that light, today's perspective looks at what public health needs are for those populations and ultimately whether there are areas where local government policies might be improved to help expedite their best assimilation into our culture. Joining us today are John Sanders, family coach, the Americana World Community Center, as Emily Dyer, executive director, was unexpectedly unable to attend. John holds graduate degrees in social work and works as a leader of the Americana Center, providing support services for families. He has been with Americana since 2018. Second, Katie McWhorter-Werner is the Kentucky State Refugee Health Coordinator for the Kentucky Office of Refugees, located at the Catholic Charities of Louisville, where she coordinates health services for newly arriving refugees throughout the Commonwealth. She also manages federal grants to fund these programs. Katie coordinates their health screening process, oversees surveillance of health conditions, and develops policies for their health care needs. Katie, a former AmeriCorps veteran, so to speak, coordinates with local health clinics, academia, health departments, and resettlement agencies. She holds a master's in international affairs and has worked with this population for 13 years with time spent in Louisville and Chicago. Finally, Liz Edgell, Director, Refugee and Immigrant Services, Family Health Centers. Liz is an RN BSN who supervises the Community Health Worker Program and is the agency's Title VI Compliance Officer. Liz provides direct health systems education to newly arrived refugees and coordinates services for FHC Americana, a pilot for refugee assessments in Kentucky, which houses the Survivors of Torture Services Program. She is the current chair of Health Literacy Kentucky, a group that works to improve health communication and health systems navigation across the state. Finally, we'll ask our board member, Dr. Patricia Bautista Cervera, to provide expert commentary as needed in the end, given her experience with La Casita. Each panelist will have, and this is truly the chair's way of trying to give everybody fair presentation. So 7 minutes maximum. And to those presenting, as the board is aware, I'm pretty tight on timing. To present brief background on their organization, followed by any identified public health policy needs, resources, or barriers to success. We will then open the floor for discussion following their presentations. So, John Sanders, you're up first.
Hello, thank you for having me. My name is John Sanders. I'm a family coach at Americana Community Center. So what that means is basically any of our individuals could come in and set a goal and whatever, and then I work alongside them to achieve that goal. That can be anything from crisis management, housing issues, long-term business setup. But I also do a lot within the health field, navigating health systems, helping people deal with health issues that they are currently dealing with. So I was asked to kind of highlight some of the things that I see as a individual provider. One of the major things that we see is lack of language access and representation from the medical community. We often will call and wait on lines to try to talk to different Medicaid providers or things like that. And then when we finally get to pick up 20 minutes into our session, they say, oh, we cannot use your interpreter. We have to use our interpreter. And then we're back to square one for them to get another certified interpreter. So all just for a simple asking of one question, it may take an hour and a half of somebody's time, which is an hour and a half that they cannot be working or other things like that. We also wanted to highlight the lack of health insurance. It's often, a lot of our participants use Medicaid and they often have to recertify. So they're, but the language, the papers that are mailed to them come in English. So, and have a high level of understanding of the medical field to for them to recertify. They have to check everything off. They have to prove that their status is not changed, and they mail it back. And this seems to happen every few months. So they often will one day just realize that their medical coverage has lapsed because they missed a piece of paper. Because if they don't have the language access, they were never going to be able to complete that paper in the first place. And that is just also, even if they had all the language access in the world, the medical system at large is incredibly confusing. So me, as a person who was born in the United States, who had all the privileges afforded to me, I still have a hard time navigating that with their assistance. And asking them as individuals to do that puts a stress upon the community providers like us to help them do that. So, like, we're only several people at Americana, but we do our best to serve them, but we cannot see them all days at all times. There's also a heavy fear of medical debt. Things seem to accumulate. Just any kind of basic procedure that could put them into a financial tailspin. And then what we really wanted to highlight was there's a lack of training and understanding about eligibility regarding people's different migration statuses. We don't ask every medical provider to know everything about the immigration system. That would be a huge ask in and of itself. But often they are turned away because they have a status that is not one of the most known statuses. Often providers will know citizen, they will know permanent resident holder, but they won't know things like parolee. They won't know temporary protected status. Things that and because of that, they don't want to put themselves in legal jeopardy, so they often are underserved. And then, while this is not necessarily in the medical field, we wanted to highlight also the housing has become a large issue, and a lot of our people's health outcomes have been tied to their unstable housing that they've been experiencing in the last several years, with the rising of rents and the lack of affordable units being available to them. Yeah. Thank you for having me.
Excellent, thank you. And we look forward to questions. I've made my list, so we hope everyone else has too. Let's see, Arlena, then we have Katie next. Is that correct?
Correct.
Okay, Katie, are you there?
Yeah, hi.
Hi, how are you? Thank you for
Good.
sharing.
Yeah. I don't know if you guys were gonna show my slides or
Yes.
okay.
And Catalina, who's driving? Or someone who's driving the slides?
Catalina will be.
Excuse me, please.
Catalina will be.
Catalina, so just let us know. You may begin.
Should I wait till I see the slides?
Sure, if you have introductory comments, you can.
Okay,
She just
sure.
has
Well,
to
yeah, we
load
could
it.
Yeah,
She just
no
has to
problem.
load it. There
No
we
problem.
go.
Yeah.
Go
Well,
ahead and start your comments.
Yeah, sure. So I'm Katie McWhorter Warner, and I'm the state refugee health coordinator through the office or the Kentucky Office for Refugees. And we're housed within Catholic Charities of Louisville. That happened about in the early 90s. So each state kind of runs their refugee programs. You can skip on to the next slide. Excuse me. So yeah, each state has that's going to resettle refugees, has the coordinator office, but each state does it differently. We're called a replacement designee. So instead of it being a state government office, so some states they're located in like their DCBS office, or they have their own state office. Sometimes it's split up where our office is in both the health department, and then kind of more on the social services side, they're on with DCBS.
And
then our
DCDS, excuse me, and on acronyms, can you tell the group what they stand for, please?
yeah, sorry, that's the Department of, let's see, I can never ever remember all the acronyms.
But that's okay, just
Community
generally what they do.
services. Yeah, the community services. That's, benefits like SNAP and TANF, KTAP,
Okay,
more
thank you.
acronyms, but
Okay, no problem. Keep going.
so we administer federal funding from the Office of Refugee Resettlement, or ORR. So we're federally designated to coordinate refugee resettlement services across the state. We provide grants management, policy guidance, and program development, all in the attempt to promote self-sufficiency and community integration. So we subaward and contract with organizations across the state, school districts, community colleges, and of course our health clinics and mental health services. And most refugees that come in can be eligible up to 5 years, but most of that funding gets to them within that first year. Um, our office has 10 full-time staff members, which is pretty new. We've been growing over the last couple of years as the influx has increased. We have a state refugee coordinator, a program director. We have someone we call RCA, which is Refugee Cash Assistance Coordinator, Refugee Health Promotion Coordinator, and that's more on the mental health, behavioral health, substance abuse, and domestic violence side of things. She helps develop programs to help with that. We also have youth mentoring program coordinator, an adult learning and career advancement coordinator, school impact coordinator, and a grants administrator. And you can go to the next slide. So Kentucky kind of as a whole, just to give you an idea of where everybody's resettled, there are 4 resettlement agencies with 7 offices across the state. Louisville has 3 offices now. We have Catholic Charities has Migration and Refugee Services. We also have the Kentucky Refugee Ministries with an office here in Louisville, and we just opened a new one, and they opened in September, and that's the International Rescue Committee. And then, of course, there's offices in Bowling Green, Owensboro, Covington, and Lexington. You can go on to the next slide. So I thought it might be helpful to show some numbers and arrivals, but right before that, I'll kind of give you an idea of what do all the immigration statuses mean. So as a refugee, basically once a person is applying for status and has been deemed eligible and approved by the USCIS, which is the U.S. Citizenship and Immigration Services, they undergo an overseas health screening, and that helps identify the needs. And then when they come to the US, they will get that post-arrival health screening, which is what my office helps fund and what we contract with our clinics for. But what we consider a refugee is someone that goes through that process where they're highly vetted. We know when there's an arrival. The resettlement agencies help with housing, get them settled in, pick them up from the airport, provide ESL classes and language training, help with employment, things like that. But we have the special immigrant visas are individuals that were either in Iraq or Afghanistan that they helped with the military. A lot of them provided translation services, things like that. And then our Cuban Haitian entrants, Afghan humanitarian parolees, and then the Ukrainian humanitarian parolees are individuals that they have come from overseas, but we call them kind of walk-in populations. We don't always know when they're going to arrive. They just are kind of there now. So that's not as easy for us to predict the number every year, but that's sort of kind of how we define them. But they all fall under the role of refugee for funding purposes. And as I move forward, of just talking about different populations. But we also have what we call secondaries. And those are folks that maybe moved into one state initially and have moved. those seeking asylum, and those that are victims of human trafficking. And so you can kind of see this was in our federal, we follow a federal fiscal year. So in 21, we had a total of 4,319 arrivals across the state. We go to the next slide. And then this was last year. It's a much higher number. We had 11,826 arrivals. And a lot of that was due to, we had a big increase of our Cuban Haitian entrants. And that's, again, one of those walk-in populations. So that's where we've had a lot of the increase in hiring and services and things like that across, especially in Louisville, is where a lot of them arrive. And go to the next slide. And then these are our numbers so far for this year. Kind of, we have it both just all together across the state. So far we've had 8,387. But if you were adjusted to take out our Cuban Haitians, it's down to 2,411. And then we have some of the top 5 nationalities and populations that come in. So obviously those from Cuba, the Democratic Republic of Congo, Ukraine, Haiti, and Afghanistan. And then these are the numbers for each city across the state there. And then you can go to the next slide. And then just, I think this surprises a lot of people where Kentucky ranks nationally. And of course, these numbers are based on just what we call those refugee, the not walk-in populations. So that's why the number doesn't match with the others. That's kind of where ORR keeps a lot of the numbers, also the State Department. But it's surprising that Kentucky ranks 4th in the number of arrivals that we have. So, and if you think about like bigger states like Texas and New York or California, you know, I think it's kind of surprising. You can go on to the next slide. And then I know you guys give out those slides and things, I think afterward, you make those available. So I added a lot of helpful links if you need any other or have questions or resources. And that last one is a YouTube video that kind of shows the journey of a refugee.
It's interesting, fascinating, and thank you for those links. That's extraordinarily helpful, and some interesting insights. So let's move to now Liz for her presentation. Good morning.
Good morning, everybody. Catalina, I have slides also. So I'll go on and say that I'm with Family Health Centers, and I think many of you are aware that we are a safety net provider. Go on to the next slide, please. So it aligns with our mission to serve refugee and immigrants, and we have had a formal refugee services program since 2007. So our goal is to create welcome for everyone as the safety net provider and as Louisville's demographics change. Next slide. So one of the programs that Katie's office, the Kentucky Office for Refugees, funds is the Domestic Refugee Health Assessment. And Americana, the tiny trailer on Southside Drive House, is the pilot site for refugee health assessments in Kentucky. So we still contract with KOR and we help train other providers across the state. We're in conversations with folks from Bowling Green and from Covington lately, and we have we do outreach and training for other providers here locally too, so that they know how to do the refugee health assessment. We share our lessons learned. So as we talk about ask, we'll mention that the clinic, we got some federal funding thanks to Congressman Yarmouth. We will be renovating a wing of the Americana Community Center so that that trailer that we've been in for 16 years, we can say goodbye to it and we can try to put the clinic under a roof with the rest of our services. But I'll go on and put a plug that we'll probably need additional funds and be running a capital campaign to support that project. So next slide. The Survivors of Torture Services is a small program, but very intense, as one might imagine. There are very few people who qualify for this. So not every refugee or not every immigrant who has experienced trauma actually experienced torture or is a secondary survivor of torture. So it's a pretty small definition that it is also funded by the Office of Refugee Resettlement. We provide very comprehensive mental health and case management services and link folks to legal and medical and everything else that they need. And that's in partnership with the U of L Kent School. And there are survivor of torture services, like we partner together and share funding and training with an office in Lexington and also in Bowling Green for the survivors of torture services. And similarly, we are starting right now to staff up and receive funding for a new program. We're calling it the STAR Project. It's supporting transitions of Afghans into resettlement, and it is for Afghan survivors impacted by combat. So that's one of our newest programs. Next slide. This is our, when thinking about what we do, we try always to incorporate culturally responsive care, linguistically appropriate care, and trauma-informed care so that we can restore dignity, choice, and trust for our clients. This is called the Healing Encounters approach. Next slide. We want to talk for a minute about how we partner. I think that the silver lining in the pandemic was that Louisville did a really nice job of coming together with the health department, with La Casita Center, with the Americana Community Center, and really listening to our refugee and immigrant community members and really those most impacted, and then adjusting and learning and not just doing things the way we always did them, but actually doing things that the way the community needed. So my hope is that we continue on that and continue to use those lessons learned from the pandemic. Next slide. Lost my slides there. I'll go on and keep talking. Hopefully the slides will come back.
There we go.
There we go. So that next slide. Yeah, so I wanted to also put in a plug about community health workers. As a nurse and as the chair of Health Literacy Kentucky, I really will say that I think community health workers are one of the vital resources that we need in our healthcare system, and Kentucky's doing a really nice job of growing the training programs and opportunity. I think everyone's excited about the prospect of Medicaid reimbursement for community health workers, but I want to put a plug in that I think there's a role for city support as well, because there's so many services that they do that will not have a CPT code that aligns with it. Or one of our partnerships is that La Casita Center. We have a shared CHW, a community health worker who spends some of her time at La Casita and some of her time at family health centers. And it's a pilot project and it's going beautifully. But La Casita, for example, wouldn't have a medical provider and be able to bill Medicaid if they were alone. So I just want to put that plug in. Katie's office funds some of our refugee-focused community health workers. John's office, we're upstairs from him. We have physical space in the Americana Community Center. So I think there's really beautiful partnerships highlighted by our community health worker work. And it needs to be that way because they need to be the link to the community services and to the client. So next slide. This is, John mentioned, I'm just going to echo really quickly, the housing challenges, especially for folks who might not, when immigrants come of any status, they don't have a work history, they don't have a background check that goes very well because they have no history here in the US. And then some of our populations obviously may be undocumented and may not be able to have public benefits to assist them with housing. And the precarious housing that many of our clients in can cause some real health concerns. So I think Louisville's housing needs are there for everyone, but they're highlighted by our refugee and immigrant population. Next slide. Our community health workers always say it every time: housing and transportation are the top concerns for their clients. On the medical side, there is non-emergency medical transportation. It is a doozy to apply for. It's only if you're Medicaid eligible. The phone trees are in English. You can't schedule closer than 3 days out. You can't schedule more than a month out. So we actually have a care coordinator who spends huge chunks of her days helping patients schedule their Medicaid transportation. So none of this is simple. The TARC 3 application, I think, is 6 pages long in English. So all of this, again, it's barrier for everyone, and then it's highlighted by our refugee and immigrant community. Next slide. In terms of medical gaps, I think dental care, for certain, that's a problem in all of our communities. Again, we don't have enough providers. We don't have enough providers who accept Medicaid. We don't have enough providers who provide language services. It's very hard to have a telephone interpreter even when you've got fingers in your mouth or things in your mouth. So at Family Health Centers, we found that in person is actually the best, although it can be costly. And Google Translate doesn't work well in a medical setting. And they're just simply, our safety net providers are at capacity. So that's a challenge for all of us. In terms of immunization support, I think that all of the VFC, Vaccine for Children providers are doing their best. There's refugees and immigrants have a catch-up schedule. They need to catch up on a lot of vaccines. It's a lot of extra steps to get everybody caught up. And then we also provide immigration-related immunizations.
We need to wrap up.
Okay, next slide is our biggest ask. It's about language access. If you'll go ahead one more slide, please. What would you do if you received this? This is just an example. Next slide. So that was an appointment reminder in Kinyarwanda, and my community health worker translated that because she thinks that reminds people, you know, what would you do if you got something you knew it was important, you couldn't read it at all. Next slide. And I just want to talk about Family Health Centers. 36% of our patients have limited English proficiency right now. That has grown 35% in the past 5 years alone. Next slide. And there's a cost to that. We're trending towards $1.3 million in language services at Family Health Centers this year. So there's a huge cost financially for interpreter services. Also, for the extra time it takes with providers, that means you're seeing fewer patients. It means your telephone lines get longer because calls take longer. It really impacts and creates a stress on our programming.
Let's wrap up in 30 seconds.
All right, so that's the big ask. That we have had flat funding from the city for the past 9 years, but we're seeing the bulk of Louisville's refugee and immigrant patients in the medical setting. But I think there's a role that city government can play in helping to support language services, not just in healthcare, but in all the social service providers, that we really can't make Louisville home unless they have language and communication.
Thank you. And thanks to all the speakers. I think you have provided a plethora of information that first shows the collaboration among your groups. That I had made a note in the very beginning with regard to how the groups coordinate, and all of you have woven through those threads, and appreciate that, so that there's no non-duplication of services. That being said, I'm going to open the floor to the board for questions to our panelists. Board? Let's have board members first. Ms. Handmaker.
I just had a question about Catholic Charities, which seems to be much more active in Kentucky than in other states. Do you have the background for that?
We're part of the USCCB is the VOLAG for Catholic Charities on the side of refugee resettlement. But other states, they're all kind of ran a little bit differently, and it's all kind of each state has its own programs and separately. So I can't really speak to how much they do it. But I do know when we have a national conference that there are other folks that are in Catholic Charities. I believe the refugee or their state office in Maine is through Catholic Charities as well. So,
Well, what they do in Kentucky is very impressive.
Yes, it certainly is extremely impressive, and the wide span of their services is as well. Others, please. Dr. Patricia, any comments from you? You're on mute. Hear you. Still can't hear you. And while you're fixing it, Deputy Mayor George, floor is yours.
Thank you. I have 3 questions in the chat, and it may be too much for this conversation, but I'm really interested to know what are the specific recommendations, things we can do to have the biggest impact to improve the interpreter service piece. I mean, it sounds like, I certainly hear Liz on the funding challenges with their $1.3 million budget. But beyond that, I heard John mention several other challenges just as it relates to support with health navigation. So I'm interested in specific recommendations there. I'm interested to know what services are not Medicaid reimbursable through the community health workers. And last but not least, I'm interested to know what collaboration has taken place with TARC as it relates to our immigrant population and accessibility of TARC 3. So maybe too much for one, but yes.
Let's take Deputy Mayor's questions. Who's going to start?
Well,
Yes, ma'am.
I can speak to the Medicaid and CHW services a bit. It is still in development. The law is supposed to go into effect, I guess, June 29th is when new laws happen. Or by July. It seems like they are still fine-tuning what the CPT codes are going to be and what that's going to look like. We still don't know a whole lot. But I'm thinking about things like, I'll just give a story as an example. An 8-year-old was hit by a car, hit and run accident. We found out it was a Congolese child. My friend is an ESL teacher. She texts me this sad story. My student got hit. I text my community health workers and say, did you know there was a Congolese kiddo in a car accident? Chope, my CHW, says, I've been working on it. I can't find the family. So I link her to the teacher. She goes on Sunday night, visits the family to make sure that the 8 kids that are left at home are okay. Mom's at the hospital. Mom and dad are at the hospital in the ICU. So that's not billable. Some texting, doing a home visit to check on the kids. So there's wraparound. There's just so many things that they do. Right now, we have a nice model where the salary can be funded through the Kentucky Office for Refugees. But it's all piecemeal right now to kind of cobble that together. So just like the breadth and depth that they offer is never going to be in billable chunks of time is my concern, and limited settings.
Others, John?
TARC, I don't know about language access with TARC. I have worked with TARC in the past and had them come do training with Family Health Center staff on kind of how to navigate. And, I think they struggle also because they're a nonprofit as well. So I have not, I need to revisit with them what the language access things are.
And to that point, I think it's important. There are 2 issues here. One is I'm wondering about partnerships with companies like Uber, Lyft, and those, and the taxi service. I'm lost on who that is, but nonetheless, some funding from the large providers of those services. Secondly, with regard to forms, and I'll go back to the deputy mayor on this because that's the one piece that stood out to me. That is, I'm wondering with regard to the forms that are necessary, I'm not asking for an answer to this question, but rather making a statement that whether we need to identify, is it a local government form? Is it a state government form? Or is it a federal form? Because if it were local, we would have much more control over the obvious translation of those documents. And there might be sway through congressional and state legislative offices to do something about those forms. So the federal would be a lot harder, but the local should be a easier thing to do. So let's, Deputy Mayor, we can look into that. And anyway, next questions?
Can I speak to the address the interpreter issue question?
Yes, please.
Yeah. So often a lot of the ways that we do our interpretation is via phone interpretation, just because of the wide amount of groups that we serve. However, that means that we're usually contracting with out-of-state providers through that have large infrastructure. So if I had to like recommend, I would recommend maybe creating a pool of money or opportunity for local people to become certified within Louisville, as well as funding local interpretation services that don't have a huge overhead, like Below's BLOZ, which is a local provider, and then also identifying within Louisville the major community programs, community groups that are not being automatically translated into documents that are mailed out. So Spanish is mailed out, but like Somali is not, or Karen is not. So I really identifying heavy populations or this is not necessarily an interpreter or a community broker with the city within that community. Somebody who, like Liz says, went to church that night and ran into the family or something like that. We get a lot from just having friends in the community who get us across the finish line.
Board members? Community advisory, Ms. Handmaker?
I don't know if there's anything to learn from this, but court services, Kentucky court services have to provide interpreters for every possible language. I think they have like 180 languages. And maybe there's something to be learned from the
A good contact. Excellent.
I will say, sorry, but I would say that the time that I have had to take people to things like eviction court and things like that, that the interpretation services have been woefully lacking in that time. The judges texting the interpreter to then come down the street, to literally walk into the office. They often do not pick up, and if they do, they're not facing the microphone. There's a Zoom disconnect. Honestly, that would be another plug. I know it's not the public health thing, but that is a huge thing that I've had a lot of issues with.
Deputy Mayor, there's one, an additional one. Thank you. Other questions from any on the board call? Yes, ma'am, Dr. Eccles.
I would just say, I don't even know if this is more of a comment than a question, but I know as a provider that works in the community, sometimes I struggle with, we have really large, as we've spoken to Cuban and Haitian populations, and I can, kind of mangle my way through Spanish with like the limited things I need for, prescriptions or things like that. One thing I find with some of our other populations, though, is I have access to interpreter services or a lot of these community pharmacy chains have access to interpreter services. Google Translate, I agree, it's horrible, but that's another soapbox for another day. But sometimes I struggle with even knowing what the language is that they speak, especially with a lot of our refugees that are from different African countries. I can spend almost 10 minutes just trying to figure out what language it is that I need the interpreter for. So I don't know if this is just like a possibility or even like just something that, like, for those of us that have access to interpreter services but maybe don't have like a good community health partner, if there's a way to even have some of our refugee population that we're going to have out in the community with even just like a little card or a little something to let me know, what their primary language is, because I can print out reference materials for them. I can print out medication guides and all kinds of things, and I have access to a lot of different languages, but sometimes I just don't know, what it is that they need. So
So-
that's kind of a question slash comment.
Right, to those who are speaking, and then to Dr. Batista Severa as well. I think that's an excellent idea, Dr. Nichols, in terms of what the organizations that our speakers spoke about. That might be a message to them that they could coordinate through their collaboration, a card or something that would expedite this process. Thank you. Let's go with one more. Yes, Ms. Shoemaker, you're on mute.
Can you hear me?
Barely.
Okay. So I know John mentioned the,
Can you turn your volume up? Or speak right into the mic on the PC?
can you hear me now?
A little bit, yes.
Okay. I know John mentioned the, Medicaid renewals and that being a barrier, because, the notices are going out in English. So just as a comment, I wanted to say that our, outreach and enrollment connectors at family health centers, we do use, interpreter services and offer in-person, assistance, with interpreters, to help people with their Medicaid renewals.
Excellent. Thank you for that.
We have a connector who comes every couple of weeks, but usually one of the things that we notice is that they'll get the thing and they just don't even realize that it's important until it's gone. That's the real kind of so I don't know if you need to like read this in big red letters at the top of the page or something like that so that they recognize not to throw it away. But that's been it's like when they notice it's important, they usually bring it to me and I help them complete it because they know that they trust this community provider to be that person. But most of the time it's like they don't know that they're in trouble until it's already over, basically.
Katie, I think you made a very valuable comment just now in the chat box. You want to repeat it for the group?
Yeah, sure. Yeah, in the past we've had some I Speak cards that have that language, and so yeah, we've been working to update those. They were just kind of out of date with the wrong numbers and different things, or they didn't reflect all the populations we have now. So we're hoping to get those updated and printed soon.
Very good. Well, I want to thank the speakers for certainly one of our more enlightening and insightful presentations for this population. Louisville, as I mentioned, has had an open door to those coming in, and as the daughter of immigrants persecuted, I am incredibly empathetic to the needs of this population. And I hope you'll stay in touch and keep us in the loop. And Ms. Shoemaker, I think it gives the Medicaid Coalition some ammunition here to help these groups or more, and I know they do, in terms of the needs. So thank you for great presentations. And you are free to leave or stay, whatever you would like to do. And we're going to move on with our business at hand. We will now go to the chair's report, and I just have a few reminders that were contained in your updates. Is going to be virtual, and the largest item, and maybe the only, but I won't jinx it, will feature officer elections for one-year term for chair and vice chair. And if there are any governance issues that arise in the time, we'll take care of those. The meeting scheduled, and I need everyone's attention on this one. The meeting is scheduled for July 5th, the day after the 4th. My question to you is, would you rather meet the 12th or do you want to go ahead with the elections and limited time for anything else that comes before us? What's your pleasure? Speak up or forever hold your peace.
I don't
And
care.
be a part and be a part of the quorum on July 5th. Yes, ma'am.
I don't,
Karen?
you want to do a vote, a show of hands?
Excuse me, please.
I said, I don't care. Do you want
Okay.
to do a show of hands, a vote?
Sure, sure, if somebody will help me here, because raise your hand.
What are we voting for? Are we voting to,
Next, July meeting, do you want it
Yeah.
the 5th or the 12th?
well, you can't show your hand unless you,
Well,
but
I vote for the 12th.
Raise your hand. The 12th or the 5th?
we keep,
Can we put it in the chat? Can we put it in the chat and then just count in the 12s maybe? I think
Arlena?
my video is going too fast, so when you say 5, I raise.
Okay, let's do that. Arlena, would you find,
You just froze up on me.
next meeting is, thank you for that. Not good at all, though.
Yes. So if they put their date in the chat, I will take the majority and put.
Summer break. At the U of L Clinical Translational Research Building where we've been before. As you know, and then we have one piece, I'm going to ask Interim Director Mendel to present. There were some need to adjust our governance documents to reflect those compliance standards, and we had a resolution in the pre-read. So, Madam Interim Director, please supplement anything I've said, or then propose what we need to put in our minutes in terms of a motion to approve.
Thank you. So basically state swimming pool and lifeguard regulations have been updated and changed. So we are changing what was established as the Board of Health Chapter 900 swimming pool and lifeguard regulations. First of which is Louisville Metro for many, many years has certified lifeguards. After the new changes and regulations and working with other lifeguard certification agencies, this is a duplication of efforts. Those lifeguards that come to us basically have all of the certification requirements. So we're removing the requirement of a Jefferson County Board of Health certification exam and test. There were, but one was written and the other was an in-pool skills test. Because all of the candidates have already demonstrated this ability through actually a much more difficult course and class. And then, so we will be assuring that they have that certification along with the appropriate lifeguard, first aid, CPR courses. So again, simply just looking to remove some red tape and complications and duplication of services. So that's the first thing that has been established. The second is to allow for lifeguards to begin at the age of 15, which is accepted by those national lifeguard certification courses, with the caveat that there is an adult, someone 18 or over on the premises. So other pool safety personnel, or not just parents or guardians of particular swimmers, but other personnel that are 18 and over. So these changes have been made by an internal committee of the health department, given that authority through the board in 2018. So that I think everyone should have a copy of the actual written document, but that's the synopsis.
Thank you very much. And if you will
Mhm.
provide Arlena with the appropriate verbiage for the approval so that we're in code compliance, that would be special.
Mhm.
And so any questions from the board? So would someone make a motion to approve the amended swimming pool regulations? So as interim director Mendel mentioned.
So
Is
moved.
there a second?
Second.
Any discussion? All those in favor, aye.
Aye.
Opposed? Abstentions? Motion carries. The amended regulations will be so implemented.
Thank you.
Thank you very much. Anything else while I've got you here? Any other barriers to present or any other updates? Just
Sure. Everyone should also have a copy of the director's report.
yes. You're fading in and out.
Oh, let's see. Is that better? Can you hear me? Okay.
Do
So you
have
should also
anything?
have a copy of the direct. Do you want me to go over the highlights of the director's report or
No,
later? Okay. Thank you. That's all I have for now.
Because I assume that
Mm,
stands out.
no, thank you.
Okay, and we welcome you and with your many years of experience. Say what your top 3 priorities are.
Yep. My top 3 priorities coming into this position is staff wellness and retention, improving our partnership
Your
okay. I don't know. I will try again. Let's see. Mine are
yes.
okay. Let me stop the video, see if that helps the connection. Okay. So my priorities are staff well-being, retention, and recruitment. That's a primary for us. I know we've spoken several times about our vacancy levels.
Yeah,
Okay.
you're still going in.
Okay.
Heidi, it's your internet.
Maybe you could.
Okay. Okay. I will do that.
Heidi, I think it's your audio and video that is the problem. We keep losing you in and out.
Dean Blakely said I'm the one with the. And we'll blame someone. Sharing, Dean Blakely, I apologize to. Welcome, and just a couple minutes. Okay, I'm in and out.
I'd like to hear what Connie was going to say. The rest Air Connie. I'd like to hear what her 3 priorities are.
Dr.
Yes, ma'am. Can you guys hear me?
And now we can't. And now Heidi.
Can rest of you hear me?
Yes.
Good, 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 good.
Okay, I'm going to give up and stop. So continue and call it.
Okay, so I think Heidi was trying to introduce me. I'll take the lead and I'll introduce myself to make life easier for all of us. So my name is Inder Singhal. I'm an ophthalmologist, subspecialist in retina, trying to slow down my clinical practice to help get involved in some civic duties. So first of all, I'd like to thank the mayor and Nicole, who's on the call, for having that faith in me and giving me the opportunity to serve as an interim medical director. You know, the way I see life, as Heidi originally said, I've been working in Belize and Guatemala for a decade now.
Hi, this is Heidi.
Hi, Heidi.
Can you hear me?
Welcome
Okay.
back. Yes.
Thank you.
So,
Go.
you know, we all of us on this call in public service, we all acknowledge all the inequities that we see in healthcare, education, jobs, and housing. And for decades, we all and our predecessors have been trying so hard to find ways to fix this, yet, you know, we seem like we get farther and farther away. You know, I ask myself these questions daily, just like you all do, just like we all do. What can we do? In my mind, anything that we do has to be a sustainable solution. You know, we already know the problems. Is how do we solve them? So my job, and I'm hoping, and my goal is to learn from you all and everyone else that I can over the next few months and absorb as much as I can, and then try to make myself useful in trying to solve some of these problems so that Louisville is a city to emulate, if not in the next year or the next 4 years, in the near future. That's my goal, and that's what I'm hoping for. And I'm happy to take any questions if anyone has one.
And as I mentioned, thank you, Dr. Single. And again, welcome. And we will have him back. And if, and for a total not only orientation, but your plans. Any questions from the group? Okay, moving along to Deputy Mayor George.
Excellent. Thank you, Chair. I'll be
update from
very.
the-
Can everyone hear
Go
me?
ahead. Yes.
Excellent. Thank you, Chair. I'll be very brief. First of all, I just want to say how excited I am about the interim appointments with public health, both with our interim chief health strategist, Connie Mendel, and our interim medical director, Dr. Single. We are very fortunate to have them, and Mayor is really looking forward to working with them. The other thing I wanted to mention is, of course, we've been very busy focused on budget season. Everyone knows the budget will be voted on by the council on June the 22nd. That's important because I heard several comments about local opportunities within the budget to support all the ongoing needs in the community, and specifically with healthcare related with our immigrant refugee community. So with that, I would just wouldn't be doing my job if I didn't mention that we need your help in thinking about ways to, raise revenue in the future, direct funding. We all know there are significant budget constraints, despite having been largely supported with art funding over the last several years. So I would just say that we rely on groups like this to really help inform what opportunities do exist, because we certainly recognize there's work to be done. Thank you.
Thank you so much. And as I mentioned, Deputy Mayor and I had a fact and perspective and priority laden breakfast. The calories were all in that. And as a result, what I would say is that in addition to funding, one of the takeaways I had from that discussion is a prioritization of what services the department should actually be offering, which the role of the department evolves over time. And there are clearly, and I put them all in, environmental changes in populations we serve, and how the health department can focus on areas that are not covered by other organizations, entities, et cetera. So it's a real microscope on perhaps the transition in those areas that take priority at the department. And I know that the Deputy Mayor is laser focused on that. Okay, thank you very much. And now, let's see, turning to our community advisory board members, which include family health centers, the school system, medical society, nurses association, and Greater Louisville, Inc. So any folks from that group, Dr. Irwin, Dr. Stone, Dr. Hargett, Ms. Manson, and Ms. Somerville. I know that Ms. Manson has allergy issues and it's difficult for her to speak. So I also know that she will send me a notice if there are things that we need to know. So advisory board members, any update on issues that are germane to the board?
Yes, this is go ahead.
I would just partner from Family Health Centers. I would just like to announce that Family Health Centers was successful in receiving a $2.2 million housing and urban development grant that will help us sustain our respite program for homeless persons. That program is located at Hotel Louisville and provides a place for homeless persons who have had medical procedures or who have illnesses or serious conditions to be off the streets in a safe environment. We do provide nurse practitioner services and caseworker services to those residents.
Congratulations.
Yes, this
and
is Dr.
Services much needed.
Yes, this is Dr.
Okay.
Hargett, representing the Greater Louisville Medical Society. And I'd just like to say that we've had a transition in leadership that occurred May 27th at the Kentucky Science Center. Our new president is Patricia Purcell. Our outgoing chairman is Dr. Brian Sunsman, and our outgoing president is Dr. Briones Pryor. The GLMS Foundation made a $100,000 contribution to the Kentucky Science Center to help promote their endeavors. And in regards to the GLMS, we'll be having our Advocacy and Public Policy Committee will be meeting tomorrow to review our resolutions that we'll be putting forth to the KMA. And we've been having a lot of discussion, as you can imagine, on gun violence and mental health and wellness in the community. So just wanted to give those updates.
And Dr. Hargett, very helpful. Thank you very much. And I mentioned Ms. Manson. I don't want to make her talk, so, but I don't want to skip. So, all right.
She doesn't have an update. I'm happy
Ms.
to go.
Somerville from the GLI.
Yes, good morning, everyone. Don't have a big update. We will be releasing our federal agenda at the beginning of July in conjunction with our DC fly-in. But I know this group often talks about certain local policy or sometimes state policy that they're interested in. We're going to start our process on our state and local agenda in August and September. So if there are any policy ideas or legislation that this group would like our policy committees to consider for our legislative agenda for next year, please let me know so that we can vet them through our process and get those added. So over the next couple of months, if there's anything that you want us to vet, please reach out. That's all I have.
Thank you so much. And perhaps there is something with regard to the presentation we had today. And I would ask Ms. Mendel if she will get with you with regard to the presentation to see if any of the issues that were brought up in the perspective session merit the attention of GLI, where they could help for their employees. I know a number of companies have those translation services and all through HR, but there might be something.
Yeah, that'd be great. Thanks.
Okay. With regard to key committee actions, either Dr. Eccles or Dr. Bautista Cervera, anything on immunization news that impacts the board? If you're nodding or something, I can't see that. But is there anything?
At this time.
Thank you. Is there any new business to come before the board? Well, I feel like the election service, our next meeting, the July meeting, will be July 12th. And if anyone would like a recount, let me know. We will get a notice out to you. Thank you, Arlena, for tabulation and for sending the note out. Any other business at all before we recess until July 12th? Enjoy June and enjoy your families, and hopefully you get some time off, and send cards and letters on if there are topics you wish us to cover in future perspective sessions or any comments on the meeting. That's how we improve. And again, Dr. Single, welcome. And you all, I'm giving a tiny bit of time back to you. I think I'm giving 13 minutes. If there are no objections, this meeting stands adjourned. Thank you so much, everyone.
Take care.